My name is Laurel Short. I'm one of the nurse practitioners here at Kansas City Bone and Joint. I work in a specialty area of physical medicine and rehabilitation, so I see patients with both neurologic and musculoskeletal disorders. One of the conditions that I treat here in the clinic is chronic migraine. Chronic migraine is a condition where the person has 15 days or more per month where they have headache, pain, and other symptoms that go along with migraine. Some of these symptoms might be difficulty with sensitivity to light or sensitivity to sound or nausea, or they may have all of these things. So it's not just headache pain, there's some other symptoms that go along with the headache pain to make the headache a migraine. And chronic migraine is specifically when the person has these symptoms more than half the month, basically. So the symptoms become very debilitating and can interfere with their function and quality of life. They often have difficulty concentrating at work or school, missing these activities, and also missing out on social activities, and really just not feeling well a lot of the time. So when patients have come to our practice, they've typically been to a lot of other providers and have been dealing with the condition for a long time. There are multiple treatments that are used for this condition of chronic migraine. And the treatments might include oral medications. They might also include some types of physical therapy and other non-medication treatments. There's a newer treatment used for chronic migraine and chronic headaches that involves using Botox injections for the chronic migraine. And most people have heard of Botox for cosmetic uses, but it's actually been used medically much longer than cosmetically. And we're finding it very effective for chronic migraine, and it is an FDA-approved use of this medication. So the injections are given in multiple places on the patient's forehead and over their ears and into the back of the neck. It's used with a very small needle, so it's not very painful. Most patients say that it's nowhere near what their headache pain involves. When a patient who has migraine symptoms first comes to our clinic, we meet with them and evaluate them to determine what type of treatment is going to be best for their symptoms. If we determine that they're a good candidate to use Botox injections, the treatment is done, and then if they're a good responder to the treatment, it can be done about every 3 months to help manage their chronic migraine. Many of these patients are able to then decrease or discontinue use of their oral medications that can cause a lot of side effects. So this has been a very rewarding area for me, and I really enjoy working with our migraine patients. If you are someone who experiences migraine headaches or chronic migraine, or aren't sure if your migraines qualify as chronic migraine, we would be happy to meet with you and come up with a comprehensive treatment plan. Our goal with our patients is always to optimize their function and their quality of life.